Hello, I'm with Dr. Kreitzer from the Center for Spirituality and Healing at the University of Minnesota. Welcome, Dr. Kreitzer. Thank you so much for being with us today.
You're welcome.
Okay, so I'm very pleased that you are going to give us a little bit of an idea of what you're doing now. I know you started this particular Center for Spirituality and Healing, which was very, very innovative when you started it. So if you could give us a thumbnail sketch of the history of the center and the mission that you have, that would be a wonderful place to start.
Sure, I'd be happy to. Well, the Center for Spirituality and Healing started 22 years ago. And at that time, I was concerned, how do we really improve the patient experience? How do we bring culture, spirituality, integrative therapies into the experience of patients who were in the university hospital? And so we actually started out with that focus on clinical care. But after about a year and a half, Emma, there was such a large interest in education, in research. Healthcare professionals wanted to know more about, and I'm calling them today integrative therapies and healing practices, but back then it was called more alternative and complementary medicine. And so we actually took a step back and said, what should the role of the University of Minnesota be in advancing science, advancing knowledge, advancing education, and new clinical models in this emerging field? And so the center today, has a mission of really addressing all three of those areas. In the area of education, we actually offer over 60 academic courses that students can build into their degree program. So they might be getting a master's or a doctorate degree in almost any field and could take a minor in integrative therapies and healing practices. And interestingly, we get students from almost every area, not only health sciences, nursing, medicine, public health, but we get students from architecture, business, law, that just want an integrative perspective to inform their worldview. Then we also have a graduate certificate in integrative therapies and healing practices for people who are coming back to school, don't necessarily want to earn another degree. Many of them are practicing health professionals, and they can take a 12-credit graduate certificate. Then we also have a master's degree in integrative health coaching. And that program we've had for 5 or 6 years now. So those are the kinds of things that we do in the academic realm. With that large a faculty, as you can imagine, we have a lot of different research efforts. And I'll just say that we have very strong focus in chronic pain management in our research, in self-care practices, in mindfulness practices. And so I won't go through all the research we do. I'll tell you a couple of studies that I'm involved in. I'm a co-investigator on a newly funded study. It's a big NIH trial looking at mindfulness. And the topic is human-brain-computer interface and the role of mindfulness to enable people to control remote devices. So the application is for people with prosthetics, that might be in wheelchairs. And so that's a very exciting collaboration with biomedical engineering. We have another study I'm on is a study of mindfulness with people who have had a cardiac event. And we're comparing mindfulness without cardiac rehab we're comparing cardiac rehab with mindfulness compared to just cardiac rehab alone. So all the other faculty are involved in many different areas of research. So that's a big focus for us. And then a couple of other areas, Emma, that we focus on. We're really interested in collaborating with the community in a variety of ways. In the clinical arena, I work with hospitals and healthcare systems, not only around the United States, but even some internationally. How do we build new care models that are, interprofessional, that are team-based care, that include integrative therapies and healing practices? So that's an area, a focus we have. We also work with businesses and corporations on creating healthy work environments. And so we have programs on resiliency and well-being, mindfulness at work. We also work with schools, like elementary and secondary schools, and have an initiative on mindfulness in the schools. So I would say the big change in the center is that in our early years, I would have described our focus being on transforming healthcare. And while we're still very involved in transforming healthcare, today I would really describe our vision mission being focused around advancing well-being. And well-being in people, individual people's lives, but also in organizations and communities.
Fabulous. Well, I know one of the questions for the people who are following IMHU, Integrative Mental Health for You, is how can we participate? And are there online courses? And I honor everything you're doing, Mary Jo, in the realm of academics. It's just fabulous. It's a real way shower as far as I'm concerned. But those people who don't necessarily want to get into a program or an academic program, are there things that they can do?
Yes, I mean, what I would like to do is direct your followers, Emma, to our public website. So we have a center website that's www.csh.umn.edu. But the public site that I think would be really exciting for your viewers is called Taking Charge of Your Health and Well-Being. And that URL is www.takingcharge.csh.umn.edu. And on this website, we actually get between 250 and 300,000 unique visitors a month. And we get visitors from all around the world. Half of our visitors are from outside of the United States. And on this site, we really do focus on how can people assume more personal responsibility for their health and well-being by learning about integrative healing practices. So we have information on anxiety and depression and stress management and mindfulness. How can we help people really build a well-being in their lives? And so if your viewers go on that website, they'll see the center's well-being model that I'm happy to talk about that looks at 6 different dimensions of well-being. And people can do a self-assessment, and they can actually set up for themselves a personal plan for health and well-being.
I've looked at that, and I just think it's fantastic. So I'll be sure to post these particular websites, URLs, so that people can see it beneath the film that we're doing, the film interview. But if you'd like to, if you have time to share a little bit more about that program, I'd be happy to have you do that.
Sure. Well, sometimes people think of health and well-being as being the same thing, and we really believe that health is just a dimension of well-being. And so when looking at health, it's really important to look at all aspects of health: physical health, emotional health, spiritual health. We know all of those things are important. But 70 to 80%, maybe even 90% of how healthy people are has nothing to do with the healthcare system, healthcare providers, hospitals, or drugs. It has to do with self-care practices. So what we eat, how much we exercise, how much we sleep, how we manage our stress has a huge impact on our health. And so, on the website, there's information about all of those areas and how do we look at that dimension in our lives. The second dimension is purpose. And I'm sure that your viewers can think of people that they know of that might have good health, but they don't have well-being, or they might have great well-being, but they have lousy health. And often that's because these other dimensions of well-being are fulfilled. Purpose is so critical at every age and stage of life. We need to have purpose and meaning in our life. We have to have a reason to get up in the morning. And there are really interesting research studies now that show that people that don't have purpose are at a higher risk of death. And so helping people kind of explore, how does purpose show up in your life? What gives you joy? What gives you meaning? And so there's a whole section on the website devoted to purpose. Relationships is the third dimension of well-being, and the health risks of being alone are comparable to heart disease, obesity, many other chronic diseases. And in many countries of the world, this is true in the United States, there's more loneliness than there is even depression. So relationships are so core to well-being. So having people that we feel close to, that we feel attached to, that we feel comfortable with, people we can turn to, with matters of the head and matters of the heart. So relationships are core to healing. Community is important to healing. That's the fourth dimension of well-being, the community that surrounds us. And when I think of community, there's many dimensions of community. There's the infrastructure of the community, the diversity of the community, access to resources in the community. You can look at it roads and bridges, or you can look at it parks and places to be outdoors. But we know that community and that what surrounds us is important to well-being. And then the last two areas I'll mention are also critically important. One is safety and security. So we might have good health and we might have purpose in our life, but we don't feel safe. So if we're not living in a place where we feel safety and security, that can erode our well-being. And so, safety and security is important to have enough resources, to have a roof over, our heads and food on the table, to live in an environment where we're not at risk for interpersonal violence. All of those things are aspects of safety and security. And then the final area is the environment. And each one of these areas are so huge and really exciting to talk about. And the environment, many people think about that and they think, clean air, clean water, not having toxins. Those are all really, really important. But another dimension of the environment that's important is access to the natural environment around us. There's more and more research on the importance of connecting with nature, that in so many ways nature heals us. And so what we really encourage our students to do and our patients to do and just the public at large is to start really thinking about choices that you can make in your life. And, how do you put together a personal plan for health and well-being by looking at these dimensions?
Fabulous. Well, I thank you so much for giving us more information about that. I'm sorry, there seems to be a little bit of echo suddenly. Do you hear it?
I don't hear it.
Okay. That's good. Well, I know that our time is short, and I appreciate so much you're giving us your time today, Mary Jo. The program is fabulous, and I am certainly going to encourage the people who are following IMHU to look into what you're offering. And I wish you all the best as you move along with what's next.
Thank you very much.
Okay.